Dr. Stevenson, the next question says, I have been told that I have mitral regurg. I've been told that at some point I'm going to need my valve fixed. Why do I not need it now? Is that something that has just followed over time?
Mitral regurgitation is reasonably explanatory if you think that regurgitation means to come backwards. A mitral valve normally works by bringing two leaflets together, much as my fingers are coming together. When the heart pump squeezes, when the left ventricle squeezes, these two leaflets come together and prevent blood from flowing backwards back into the lungs. Now, mitral regurgitation is a reasonably common situation or condition, and a small amount of mitral regurgitation is unlikely to cause any substantial problem. And many of the people who do have mitral regurgitation, whoever asked this question, you've probably had it for a while, but you're being followed closely, and we have certain aspects of the heart that we watch to determine when the mitral regurgitation is becoming more of a problem for you. With any surgical procedure, and I might mention, since Connie a minute ago asked what's new, there is another new procedure that is being done in patients who have severe mitral regurgitation who are not considered good candidates for maybe a standard operative procedure, and that's called a mitral clip, where the two leaflets of the valve are brought together and affixated with a clip. And that also is a procedure that one of our interventional cardiologists is preparing to initiate at St. Bernard's. We have to balance the risk of any type of surgical intervention as opposed to the benefits. If you've got a little bit of mitral regurgitation and you're not symptomatic, you're not short of breath, your activities of daily living are fine, I can't do any better than I'm not having any problems, doc. And I frequently tell my patients when they're in, I say, listen, what I really like is to perform an operation on you and have you come back and see me in about 6 weeks and tell me you're a lot better. I don't like it when you come back and say, well, you know, if you'll give me another 4 weeks, I'll be as good as I was before you operated on me. I don't like that. So we have to pick our time. We generally watch the size of the heart chambers. When those chambers begin to enlarge, we know that the heart is working overtime and is trying to compensate. That's when we intervene, because at that point, the risk of the operation is much, 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 much less than allowing you to go forward with it. And eventually, if you don't have something done, and I might just mention, before I came here today, I did one of these operations on a gentleman who had been trying to put this operation off, and he was at the point where if he didn't have it done now, his heart was going to be so damaged that we couldn't do anything at all about it. So we balance the risk against the benefits. We watch this mitral regurgitation to see whether or not your chambers begin to enlarge.